Hello, I am Dr. Kristen Honey, the Chief Data Scientist in the Office of the Assistant Secretary for Health at the U.S. Department of Health and Human Services, or HHS. I am a scientist and a Lyme disease survivor. I personally know how debilitating Lyme disease can be because I was bitten by an infected tick in 1999. I was misdiagnosed for 10 years and increasingly sick over those 10 years. After a proper diagnosis of late-stage Lyme disease, then it took another 2.5 years of full-time healing and recovery before I could work again. Now, 22 years into my Lyme disease experience, I am the director of the HHS Lyme Innovation Initiative, working from within federal government to bring about the Lyme tipping point. I lead our LymeX Innovation Accelerator, or LymeX for short, including the $25 million LymeX public-private partnership to accelerate progress. Federal priority and action are needed for Lyme disease, which is the most common vector-borne disease in the United States. The CDC estimates approximately 476,000 Americans are diagnosed and treated for Lyme disease each year, every single year. By the numbers, today's Lyme disease trends are all heading in the wrong direction. More infections, more geographic regions impacted due to climate change, and growing economic and societal strain costing the United States billions of dollars every year. In response, to turn the tide on Lyme disease, HHS and the Stephen and Alexandra Cohen Foundation announced our $25 million LymeX partnership in October 2020. This is the largest public-private partnership in Lyme disease history, and we're only 4 months old. We're just getting started. So what exactly is the LymeX Innovation Accelerator? It's modeled after the successful KidneyX Innovation Accelerator that is transforming dialysis and kidney care by incentivizing innovation and grand prize challenges. Both KidneyX and LymeX are collaborative efforts to accelerate breakthroughs in the diagnosis, prevention, and patient outcomes for health issues where our U.S. market has stagnated for decades. Dialysis technology is virtually the same as it was 40 years ago. Lyme disease diagnostics and treatments are unchanged since the 1990s. How many of you are using the same computer you had 30 years ago, or watching the same TV from 30 years ago? Not me. Market change and innovation are needed, and LymeX is our catalyst for transformation. Our LymeX team views our public-private partnership as a force multiplier. We are working with external foundations and leveraging outside funding sources to augment government resources so that together we're moving the field forward as quickly as possible. LymeX does not in any way replace or supersede other government programs focused on ticks or tick-borne diseases. Rather, LymeX augments federally funded science, research, disease control and prevention, and regulatory approvals for Lyme diagnostics, treatments, vaccines, and technologies. Our LymeX work has already begun to engage the Lyme community to work together to bring about change. We have 3 LymeX focus areas. First, stakeholder engagement and patient-centered innovations. Second, education and awareness through open innovation like crowdsourcing to raise awareness about risk and prevention. Third, next-generation diagnostics incentivized with a series of multi-million-dollar grand prize challenges. We call this the LymeX Diagnostics Moonshot, and grand prize winners who meet diagnostic performance benchmarks will receive cash prizes for delivering solutions. Across all 3 focus areas, patients are included in every step of the process. Like the KidneyX Innovation Accelerator, the LymeX Innovation Accelerator incorporates patients at every step of evaluation, prioritization, synthesis, and decision-making. Our LymeX methods also create a neutral, safe space where your patient and caregiver voices drive the conversation. Your stories are given equal time and equal weight with all of our academic researchers, MDs, and PhDs because we recognize that your Lyme lived experience has much to teach us. We in government want to learn from you, and now, through LymeX, our federal government has a new way to listen and learn. There likely will not be a silver bullet for fixing the problems caused by Lyme disease. To confront the complexities, we must tackle this multifaceted challenge on many fronts. We need an interdisciplinary, holistic approach that includes not only physicians and medical scientists, but also epidemiologists, environmental scientists, veterinarians, entomologists, community activists, educators, ethicists, data scientists, and most importantly, Lyme patients, caregivers, and those with lived experience. HHS created LymeX because of your community-led work. The LymeX Innovation Accelerator symbolizes collective action for transformative change with the ultimate goal of improving patient outcomes. Our LymeX partnership will succeed because of diverse participation, because of your participation. I hope you'll consider getting involved in our efforts. We'd love for you to join our online community to engage with us and others. Right now, there are two main ways to get involved with LymeX. First, follow LymeX on Twitter. Our handle is Lyme_X. Second, sign up for an account on LymeX.crowdicity.com. Crowdicity is a place where you can collaborate and interact with us and with each other. The address is LymeX.crowdicity.com. LymeX.crowdicity.com. Once you have a Crowdicity profile, then you can volunteer to be interviewed and share your personal story with the LymeX team. Your collective patient voices through our LymeX community will be heard. It is my commitment to you that our LymeX partnership will lift and appropriately channel Lyme voices and help transform HHS promises into government action and real-world impact. We must be careful that the many voices don't become a cacophony, but rather an intricate, diverse, multi-part harmony that crescendos at just the right time. That is how we will have impact. In the end, our success will be measured by patient outcomes and how LymeX improves the lives of all Americans touched by Lyme disease. Join us, and thank you.